Welcome back, dear students. So today's topic of discussion for the class is local anesthetics. So on the right hand side, you can see a picture where you can see a dental module is provided, which is connected to our brain, and that connection is blocked, and there is a syringe which is supplying the local anesthetic. And below it is written, local anesthesia stops nerve conduction. That means the local anesthetic provided here stops the nerve impulse conduction or blocks the nerve impulse conduction, thereby causes loss of consciousness. So this can be the beginning idea you all can have about local anesthetics. So this is the contents of the local anesthetic presentation. That is the definition of local anesthetic, classification of local anesthetics, another classification of local anesthetics, and the mechanism of action. On the right hand side, you can see a picture that I have provided that shows the types of anesthesia. Anesthesia is basically two types, that is general and local. And here one more is added, is regional. Now let's see what's general anesthesia. General anesthesia affects the entire body. You have no awareness or feeling. You may breathe gases or vapors through a mask or a tube. Drugs may also be given through an intravenous tube in your vein. So, with this term general anesthesia, dear students, you can have an idea that it is provided all over the body. It is not localized or restricted to any part of the body. Next is the regional anesthesia. It produces a loss of feeling to a specific region of the body. A shot is given to numb the area that requires surgery. And local anesthesia is producing a loss of feeling to a small specific area of the body and a shot of injection, or you can provide topically to numb the area. So this way you can get an idea, dear students, that local anesthetics and general anesthetics are mainly provided by intravenous route of administration or maybe topically in some cases. In general anesthesia, it is provided throughout the body, and in local anesthesia and regional anesthesia, it is restricted to certain parts of the body. Next, the effects of sedation. That is also can be said in three types. That is relaxed and awake, relaxed and drowsy to lightly sleeping. So here relaxed and awake, you can answer questions and follow directions. Relaxed and drowsy, you may sleep through much of the procedure. You may hear sounds and voices around you. You can be easily awakened when spoken to or touched. And drowsy to lightly sleeping is you may have little or no memory of procedure. Your breathing slows and you may be given oxygen. You may sleep until the drugs wear off. So now in case of anesthesia, you can see from this picture the types, whether it is regionally given or it is given as a whole, and the effects, means after application of anesthesia, what is happening and what are the stages we are getting. So this is just a general idea about local anesthetics, general anesthetics, and the effect of sedation after providing anesthesia has been described. Next is the history of local anesthetic. So in the year of 1750 to 1850, in Western Europe, the chemists and the physicians have collected the various samples of coca leaves for experiments. Now they have isolated the active principle of coca leaf. They have synthesized to a drug for the patients. Why? So that they could get a relief from pain during the surgeries. So, in the year of 1860, German chemist Albert Neumann successfully isolated the active principle of coca leaf, and he named that active principle component as cocaine. And what is cocaine? It is an ester of benzoic acid and methylacgonine. So this is a brief history about local anesthetics, how it was discovered, why it was used, and what was the first active component that was obtained, and how it has been esterified from two components, that is benzoic acid and methylacgonine. Next, coming to our topic, that is definition of local anesthetic. So, what is local anesthetic? Local anesthetics are generally drugs that upon topical or local injection, or you can say IV, cause reversible loss of sensory perception, means reversible loss of consciousness, especially of pain in a localized area of the body. This is very, very important. So it is said that it is applied either topically or given intravenously, which is causing a reversible loss of sensory perception. What does they do? They block the generation and conduction of nerve impulses at localized site of contact without structural damage to neurons. So, as a summary, if I say that local anesthetics are drugs that can be applied topically or can be given as intravenously, which causes the reversible loss of sensory perception. It also blocks and stops the conduction of nerve impulses at localized site without causing any structural damage to the neurons. So this is the definition of local anesthetic. Now, clinically it has said that it blocks the pain sensation from or sympathetic vasoconstrictor impulses to specific areas of the body, and mainly it causes the loss of sensory as well as motor impulses. So clinically it has been seen that for local anesthetic it causes loss of sensory as well as motor impulses. Now next, below you can see a diagram where this patient has been provided local anesthetic intravenously and general anesthetic as a inhalation most probably. So what happens in general anesthetic? Sedates the entire body, loss of consciousness. So what happens? There is a blockage of synapses and presynaptic calcium entry decreases, transmitter release decreases, and the postsynaptic hyperpolarization increases, and there is an increase of chlorine minus influx and K plus efflux. So this is happening in case of general anesthetic. While coming down to our topic, that is local anesthetic, we can see it causes sedation at the localized area and no loss of consciousness. Here we can also see what is happening. There is a conductional block that I said, that is nerve impulse block or nerve generation and conduction blockage. How? By decreasing the entry of sodium ion, thereby decreasing the action potential. Means no action potential will take place. No influx of sodium ion, ultimately leading to unconsciousness and numbness. And on the extreme right, you can see I've provided an example of a local anesthetic, that is lidocaine 1%. Okay. Next, here is the difference between general anesthesia and local anesthesia. So let's quickly see what are the basic differences between them. Site of action, general anesthesia, CNS, it is peripheral nerves. Area of body involved, whole body, localized areas. Consciousness extremely lost and this is unaltered. Care of vital organs essential, usually not needed. Physiological trespass is high and this is low. Poor health patient, it is very risky to provide general anesthesia, it is much safer. Use in non-cooperative patient, it is possible, it is not at all possible. Major surgery, it is mainly preferred, it cannot be used. For minor surgery, not preferred, and this is being preferred. So this way we can differentiate how general anesthesia and local anesthesia is important to us and its various benefits and its site of action. Next is the classification of local anesthetics. So coming to the classification of local anesthetic, here you can see the two major classification. Basically, the main classification comprises of the injectables and the surface anesthetics. Among injectables, you can see it has been further classified to three types, that is low potency, short duration, intermediate potency and long duration. And surface anesthetic is soluble, insoluble, and the last one is the miscellaneous drugs. So here what you can see is that in injectables, low potency, short duration, the example is procaine and chlorprocaine. Intermediate, it is lidocaine. Long duration is tetracaine and bupivacaine. For surface anesthetics, the soluble is cocaine, insoluble is benzocaine, and the miscellaneous is clovol, phenol, chlorpromazine. So dear students, this classification is very, very important for all of you. If you are asked to write the classification of local anesthetic, you have to write only this. So this classification along with its subtypes, along with the example of drugs, you have to remember. Next, coming to this classification, here you can see that it is being classified on the basis of the chemistry oriented structure or the structure oriented. See above you can see for ester there is this O group and for this amide you can see the NH group. So in ester group and amide group the further classification of local anesthetics have been done. So here you can see it is short acting, metabolized in plasma and tissue fluids and excreted in urine. These are the characteristic features and the main example of ester link that you all should remember is cocaine, procaine and benzocaine. For amide link, similarly you can see here should be an NH group and the rest of the structure is same. So it is longer acting, metabolized by liver enzymes and excreted in urine. Moreover, while drawing the structure, here I have shown you that what are the groups. That is the benzene ring that is lipophilic in nature. Here is the intermediate bond that may be a ester or a amide. If it is an ester, it is a CO ester, and if it is an amide, that is NH amide. And this N group, that is the hydrophilic group, which is the tertiary amine and the proton acceptor. So this is the basic structure of the local anesthetic. So what are the three parts? First is the lipophilic group, that is a benzene. Next is the intermediate bond that may be a amide or a ester. And the last is the hydrophilic group that is a tertiary amine and a proton acceptor. So this way you all can remember the structure of this local anesthetics. But dear students, if you're asked about the classification, you have to write this too. Now, if you remember about ester linked and amide linked, it's perfectly alright. If you don't remember, it's not a problem. But if you're specifically asked a question that write the classification of local anesthetic based on its chemical structure, then you have to mention definitely this ester linked and amide linked. Then you can't be writing this injectables and surface anesthetic. Next is the mechanism of action of local anesthetics. So previously I have given you an idea that what is happening in local anesthetic. There is no entry of sodium ion, no occurrence of action potential. So these two heads up I have already given you in the previous slides. Now let's come in details. So what happens? All the local anesthetics are membrane stabilizing drugs. What does they do? They slows down the speed of action potential and ultimately they stop the action potential. Now how does this action potential is stopped? By decreased rate of depolarization. What is depolarization, dear students? It is the excitation of neurons. How does this excitation occurs? By the entry of sodium ions. Now what it is doing? It is inhibiting the entry of sodium influx. So the entry of sodium influx is stopped by this voltage gated sodium channels. So on stopping the entry of sodium or interrupting the influx of sodium, what is happening? The signal transduction or the signal conduction is stopped. No action potential is taken place, thereby causing loss of consciousness. This is the basic idea of local anesthetic. Now, this entry of these ions is dependent on this voltage gated sodium channel. This I said you. Now, next, what happened with this diagram you can see. Local anesthetic bind more readily to sodium channels in an active state and slows its reversion to the resting state. Refractory period is increased and state dependent blockade, no action on the resting nerve. So let's quickly look onto this picture. What happened on the first diagram? You can see on binding of the local anesthetic, the gate is closed. This is closed. So on closing this, the Na plus ion cannot enter. It is going outside. This phase is resting phase. Now, in the activated phase, what is happening? This Na plus is getting inside. Means the local anesthetic is not blocking the gate. This gate is open. And when it is in the inactivated state, then the sodium ion cannot enter. This gate is closed and therefore the local anesthetic is blocking the entry of sodium ion. No action potential, no depolarization, thereby causing unconsciousness, and this way the mechanism of action of local anesthetic is working. Similarly, on this diagram, you can see these are the receptors that are being provided. So these receptors are taking the impulses. This is a pain stimulus that is going. Here the local anesthetic has been applied. This is the sensory neuron and this is the spinal cord. Now what is happening? See, this is an outside inside membrane. This is the membrane. This is the entry of sodium ion and local anesthetic is binding on this side. This is the inactivation gate opens and here this inactivation gate is closed. That's why the sodium ion cannot enter. It is going outside. Here the local anesthetic is working on it. So what happens? When the inactivation gate is closed, sodium ion cannot get inside the voltage gated channel. Ultimately, no influx of sodium ion, no depolarization, no excitation of neurons, and ultimately unconsciousness, numbness, and the action of local anesthetic is showing. Clear? So next I have provided the reference of the pictures that I've used for this presentation. Next is, dear students, thank you for listening to this presentation. Hope you all have got a clear idea about the mechanism of action of local anesthetic, the definition and the various classification, and hope this presentation will help you in doing your assignments. Thank you once again.